Hello everyone, I want to welcome you back to this Health Pulse podcast. My name is K Kirabo, a clinician. Yellow fever. We all know that we are having a mass vaccination of yellow fever that is going on around the country. Well, today we're going to be discussing what yellow fever is, and I want us to know why is the Ministry of Health interested in vaccinating the masses at this particular time. And then I want us to know who is supposed to get the vaccine, who is not supposed to get the vaccine. Well, yellow fever is a viral infection that is transmitted to humans through a bite by a mosquito that is infected with the yellow fever virus. Well, the yellow fever, of course, as we shall see, it causes plenty of symptoms, and one of them is the jaundice or the yellowing of the eyes, and that's where the name yellow fever came from. Of course, the first early sign symptom we were able to see is when someone contracts it, the eyes turn yellow. In the medical language, what we call a jaundice, and that's why it is called yellow fever. Well, there's been a lot of myth and a lot of can I call it in quotation propaganda that has been going around, especially things pertaining the yellow fever vaccine. One of my patients today called me, and I felt a little cold when she asked me that, "Doctor, aren't you sure that this vaccine they are introducing into our bodies, it is a slow poison that is going to be slowly killing us?" Of course, I had to sit down and of course think about these words. They were quite strong. Something told me that the Ministry of Health, together with the partners in the health system of Uganda, has got a lot to do, especially to build back its image pertaining vaccines. And all this started, of course, what we are not going to talk about today, at the COVID-19. People developed a lot of myths, a lot of misconceptions about this vaccine. Well, this is what I'm going to tell you today. As the Director for General Health Services, Dr. Henry Mwebase, was giving a speech, he said that this vaccine has been there for centuries and it has proved to be very safe and effective to the people. So I would urge all of us, if you can, those who are under the categories, of course, we shall be talking about, you go and get vaccinated such that you can get the protection against yellow fever. Someone would ask a question that all along the Ministry of Health has been here. Why is it that it is coming out now, to say that it's going to vaccinate the people? Well, one, Uganda as a country is an endemic country. That means it is susceptible to getting yellow fever. And the second point, Uganda as a country is having very few rates of vaccination against, yellow fever. At the same time, we've had a few confirmed cases in some parts of Uganda, that is Buikwe, Wakiso, and some other parts of the country, and this had to intrigue, the minds of the Ministry of Health and together with its partners, such that it can provide vaccination to the entire population, because statistics has it right that we've had low rates of vaccination against yellow fever. So the only way we can boost our immunity, or we can protect ourselves against yellow fever, is by getting vaccinated. Of course, someone would argue it the other way around, that Uganda as a country is lying in what we call the yellow fever belt. And what do you expect? Of course, as I said, we are an endemic country that is susceptible to getting a yellow fever. Now, that said, I want us to understand a simple science about how this yellow fever vaccine really works, before we draw the misconceptions or before we draw the myths about the vaccine. I literally want us to understand how the yellow fever vaccine actually works. Now, there is a common term the scientists prefer using. I don't know if you heard about it. We call it the live attenuated vaccines. Now, a yellow fever vaccine belongs to that category of the live attenuated vaccines. What does that actually mean? That means that a virus that is weakened is introduced into your body. Now what happens is this: when it is introduced into your bodies, the immune system of your body is stimulated, okay, to produce antibodies against that virus. Now when these antibodies are produced into your body, there's what we call the memory B cells. Now these memory B cells, of course, they will store a memory of that particular virus, such that the next time you get infected or on secondary infection, the body is able to detect that particular type of a virus, and the body is actually able to fight it off. Now in this case round, when, let's say for example, someone who got the vaccine, okay, God forbid, and this person gets, contracts the disease, they get the yellow fever, so that means that the body will be able to quickly detect this virus because it has its memory. Remember, we introduced something that was weak, you get, but the body was able to perceive it as a virus, you get, and the body was able to produce enough defensive mechanism against that virus. This is science. It is getting interesting. Now that means that on reinfection, the body is able to produce the antibodies that are already in your body that are going to fight off the disease. Or now listen carefully, or when these antibodies are there and you contract the disease, one is they assist in reduction of severity of the disease. Now this is what I always tell my patients at the hospital, that if you didn't get the vaccine and you happen to contract the disease is likely to treat you in a very bad, in fact I would probably call it the worst way. You can even die. But if you contract the disease, one, if the antibodies are unable to fight off that disease, at least they'll be able to fight or reduce the severity of the disease, and with minimal treatment you are able to get back to life. So that's how interesting yellow fever vaccine really does work. Now there are a number of questions that my people are asking, or people who are giving me a call. They're asking me now, tell us, since you've said that the vaccine is so good, who is supposed to get the vaccine and who is not supposed to get the vaccine? Well, one point I must make clear, that every one of us is susceptible to getting the disease, and therefore every Ugandan is supposed to be protected against this deadly disease, the yellow fever. So everyone who is not immunized, that means that at any time they can contract the disease, and actually they can be treated really very bad because they lack the protection against the disease. Now a number of people have been giving me a call inquiring or asking who is supposed to get the vaccine and maybe who is not supposed to get the vaccine. Well, I will start with who is supposed to get the vaccine. Now, according to the Ministry of Health, it's stipulated that everyone who is 9 months or 1 year to the age of 60 is supposed to get the vaccine in order to boost, their immunity, or to be able to get the protection against the virus. Now, who is not supposed to get the vaccine? Listen carefully. Now the point here is who is not supposed to get the vaccine depends on the strength of the immune system of that particular person. Now, just like I said, that the Ministry of Health says that who is supposed to get the vaccine is supposed to be 9 months or 1 year, okay, to the age of 60 years. Now the point of immunity is coming in. It is said to be that kids who are below when they are about 9 months or 1 year. Why? Because their immune system is not completely formed, but at least it is somewhere that it can help to cope up with the vaccine. And secondly, the people who are above 60 years, why are they not supposed to get the vaccine? This is the science. Just like I said, it lies on the line or the verge of how strong is your immune system. It is said to be that as we grow in age, or as we advance in age, we tend to have immunosuppression, and a lot of conditions or medical conditions start to set in. And it is so believed that when these medical conditions set in, they have a tendency, or they have a way in which they tend to lower our immune system. And when you get the vaccine, or when you get the jab, you are likely to suffer from the complications, or the strong complications of the vaccine side effects. So that's one of the reasons as to why the people who are above 60 years are not vaccinated. And then the other caliber of people who are not supposed to get the vaccine is the pregnant women. Okay, there is, according to statistics, they say that there is limited data pertaining how safe is the vaccine in pregnant mothers. Of course, here we are trying to look at the protection of the mother, at the same time the protection of the baby. And then the other caliber, of course, of the people who are not supposed to get the vaccine are the people with some chronic infections. If they're having infections that are chronic, and according to the research and the laboratory investigations, it is found out that their immunity is kind of low. We're saying, you're not supposed to get the vaccine. And then the other caliber of the people who are not supposed to get the vaccine is the people who have HIV stroke AIDS. Of course, we know when HIV stroke AIDS keeps on advancing, maybe to stage 3 or stage 4, we are seeing a lot of complications setting in. The cancers, the Kaposi's sarcoma, some other complications of HIV stroke AIDS. Now, this of course lowers their immunity, and at the end of the day, when you inoculate the vaccine into their bodies, it is likely to do more harm than good. So I'm gonna take you back to a slight point during the time of COVID-19. Before any person was given a jab of COVID-19 vaccine, of course, we had to first ascertain that you didn't have the virus in your body. We really needed to find out that you're not sick. The reason as to why we did that is because if we introduced the vaccine into your body, in the actual sense, or in the layman's language, we would be increasing the concentration of the virus in your body, and yet you're already sick and your immunity is kind of low. So the virus may overwhelm the body, and at the end of the day, instead of the vaccine giving you protection or boosting your immunity, it's doing more harm than good. And then the other caliber of people, of course, who are not supposed to take the vaccines are the people who are allergic to eggs. Now, I'm seeing you people who are allergic to eggs getting an excuse here of not getting a vaccine. Of course, according to the Ministry of Health, it says that to whosoever is allergic to eggs, you're not supposed to take the jab. I think that will be the science of the next day. I'll literally want to dig a little bit deeper into that, such that we bring a proper understanding on how eggs are related to vaccines and the antibodies, antigen, all that stuff. Okay, and then of course the other caliber of people who are not supposed to get the vaccines, of course we say those mothers who are breastfeeding. When someone is not vaccinated, or when someone doesn't have the protection against the virus and you contract it, someone asked me a question: what are the symptoms? I mean, what are the clinical features we are supposed to look at and maybe suspect that this person could be having a yellow fever? Well, basing on the Ministry of Health, the symptoms have been divided into two. There's what we call the acute phase, the symptoms that occur in the acute phase, and then the symptoms that occur in the toxic phase. In the acute phase, the symptoms tend to occur for about 3 to 6 days, and these include there's that rapid onset of a fever, of course headache, someone is having muscle pains, especially the back pain, the back pain, and someone is having fatigue, someone is having a dizziness. These symptoms really want to resemble those of malaria, but these ones get a little bit different when we tend to go to the toxic phase. Now, after the 3 to 6 days of the acute phase, someone tends to go into what we call the remission phase. This is where a patient who has been suffering those symptoms, either their symptoms subside temporarily, and if they don't, these symptoms of course upgrade to what we call the toxic phase. Now, what happens into the toxic phase? This is what happens. One is where we are getting the yellowing of the eyes, like I explained in the beginning of this podcast. Yeah, it is one of the critical symptoms that doesn't even need a laboratory to know that this person could be having a yellow fever. Secondly, we have what we call hematemesis. Now, this is the medical language. However, it actually means vomiting blood. Then the other thing is melena. Someone is passing out stool that is blood stained. Now, at this point, remember we are going into something like an advanced stage or an advanced symptoms of yellow fever. This is where things like kidney and liver failure start setting in. Otherwise, I want to thank you for watching this podcast, and the key points to take away home: vaccination against yellow fever is very, very important, because it is the only way we can boost our immunity against the disease. And of course, there are a number of behaviors when we are there at home that we can practice such that we can keep the mosquitoes away that are responsible for transmitting the virus from one human to another. And that, of course, we need to the draining out of stagnant water, putting on long sleeved clothes, especially for those who are living in an endemic area, and of course many other things that we can do to keep the mosquitoes away. However, I want to say thank you for watching, and you can drop a comment and subscribe. See you the next time. Bye bye.